Hello, welcome to the Coy Pharmer, where we focus on cultivating clarity in the complicated world of pharmacy benefits. I'm Justine. I'm a pharmacist with 20 years of experience in the business of pharmacy, and today we're breaking down an acronym that people can't agree how to say. I'm going to call it NADAC, some people call it NADAC, and what it actually stands for is National Average Drug Acquisition Cost. First, we're going to talk about some of the basics of this drug pricing index. Then we'll jump into the practical applications in the industry. And finally, we'll round out some of the fine print impacting this drug index. Let's dive in.
You're looking for the cure, but you're stuck in the weeds, bringing you insights into pharmacy.
In covering the basics of NADAC, we'll talk about the acronym and how this index works. In practice, when is NADAC used in the industry? What are some pros and cons for payers? What are some of the pros and cons for pharmacies? And finally, there are some key gaps in this particular index that are worth mentioning. We'll talk about some of those in the fine print. In looking at the acronym NADAC, it stands for National Average Drug Acquisition Cost. This particular index is meant to capture the dollars transferred from pharmacies to wholesalers when purchasing drug products. In practice, some pharmacies report these acquisition costs into CMS, and there are some pharmacies that opt out of reporting into CMS for the basis of this index. Now we're going to talk a little bit about how NADAC gets set and how CMS monitors and evaluates and publishes this particular index. So, as the first step in the process, the pharmacy reports the latest wholesaler invoice amounts. CMS hires a contractor to do data validation and outlier analysis on these reports received from pharmacies. For the remaining data points, they offer and calculate an average cost calculation for these products. Then finally, after all the calculations have been verified, they are placed publicly available onto the CMS website weekly, with most of the major changes coming in on the monthly update files. So looking at the timeline of how far behind the NADAC index is from actual invoice pricing. So in the very first month, this would be when the wholesaler invoice amounts are reported. It takes approximately a month for the data validation, outlier analysis, and average cost calculation to take place. And then in the third month, that's when typically the prices from month one are reflected in the NADAC index that's published by CMS. So next, let's talk about when NADAC is used in practice in the industry, some pros and cons for payers, and some pros and cons for pharmacies. So who uses NADAC? First and foremost, the most common utilizer of NADAC pricing is Medicaid in most states. This is not the only, but is usually a substantial portion of the logic used to determine what pharmacies will be paid for rendering services to Medicaid patients. There are some select states that have moved towards requiring NADAC-based reimbursement for fully insured commercial business or any business overseen by the local Department of Insurance. And then finally, there are some self-insured commercial payers that opt into NADAC-based payments because they feel that the contracting methodology is superior to AWP-based pricing. There are a handful of boutique PBMs who will offer this type of contract on a NADAC basis to commercial payers. So let's look at when NADAC is used. In the case where a PBM is contracting with plan sponsors on the basis of NADAC, they will typically also contract with pharmacies and reimburse them on the basis of NADAC. This symmetry in the basis for reimbursement to the pharmacies and the basis for invoicing plans helps them avoid any risk that they may take in having one index change in a slightly different manner than another one. What makes NADAC sticky? In the case of NADAC, again, it is rooted in actual acquisition costs. There's an actual invoice amount, and that is connected to the actual NADAC that gets published. The NADAC index is overseen by CMS, and the process is quite transparent, with CMS offering quite a bit of clarity on how the NADAC index is calculated and publishing this in a publicly accessible space. So what makes NADAC tricky? We talked about this in the beginning. Not all the pharmacies report into this index. So in the cases of certain pharmacies not reporting, this could potentially lead to a skew in the results of the average in the industry. Not all the drugs have a NADAC price listed, and we'll talk about a little bit more of this in the fine print. And then finally, index volatility, and in particular index deflation, could be problematic for pharmacies who may not be able to purchase products at or below the NADAC price. So what are some pros and cons for pharmacies? So again, for pharmacies, pricing is anchored to an acquisition cost proxy. There can be fewer reimbursement changes than when the PBM is reimbursing drugs at the MAC price, when they're reimbursing drugs at the NADAC price. And then furthermore, there is a greater amount of transparency into the calculation of reimbursement rates, as again, these are publicly available and accessible to pharmacies. Some potential cons of the NADAC index for pharmacies as a basis of reimbursement could be potential index stability risk. If large pharmacies suddenly start to report into the index, reimbursements may go down. Furthermore, NADAC price may lag behind any price hikes. So for example, in the case of drug shortage or tariffs, the reimbursement for NADAC may not keep pace with the amount that pharmacies need to pay to purchase products. And then lastly, again, this is an average type of index. So an individual pharmacy may or may not be able to purchase products at or below the NADAC reimbursement. Something that I find to be commonly misunderstood about NADAC is when a NADAC price will be published or not for a particular product. There are certain rules of thumb that may trigger more than others. This is not necessarily a deal breaker on the index, but it is important to realize and recognize which products may have a NADAC price attached and which may not. So in the following section, we're going to go through some of the reasons that a NADAC price may not be published for a certain drug and what we can look at for some rules of thumb in the industry. So as we covered in the basics, NADAC is meant to capture the price that pharmacies are purchasing drugs for from the wholesalers. However, there is a key component here that is missing, and it is that pharmacies are not necessarily required to report NADAC into CMS. So there are some pharmacies that report and some pharmacies that do not report into this index. What tends to happen, and what we tend to see in the industry, is that smaller pharmacies or maybe local chains commonly participate in the survey, and larger pharmacies decline to participate in the NADAC survey. This leads to a skew in the index, where NADAC really captures the pricing for smaller pharmacies, but doesn't necessarily reflect what the larger pharmacies are able to purchase products at. Another component that is critical to understand about NADAC is which particular components of the price are captured in the index. In this example, we have a very stripped down version of a wholesaler invoice to a pharmacy. As you can see in this example, the pharmacy is being invoiced $450 for a package of Xarelto. This piece of the invoice is included in the NADAC reporting. There are also commonly things that we call off-invoice discounts or off-invoice rebates. We have a couple of examples of this. So some of them may be attached to a certain volume threshold, some of them may be attached to a certain generic utilization rate, but these particular rebates or discounts are not included in the NADAC calculation. Lastly, if we look at the type of drugs that are included in the NADAC index, there are many products that are included. So we look at the legend drugs. There's a large reporting sample. It yields relatively reliable publishing for NADAC. Next, we have more common specialty drugs. For example, some products for autoimmune, products that have been on the market for a long time. They have a mid-size reporting sample, and they're mostly consistently published in the NADAC index. Where we start to run into problems with NADAC is that there are certain uncommon specialty drugs treating orphan or really rare conditions, and also new to market drugs that may not have enough fills available to be able to create a sample size sufficient for CMS to publish a NADAC. In this case, a NADAC may not be reported for a particular drug. As people discuss the coverage level of the NADAC index, a lot of folks focus on the idea that the vast majority of claims tend to be covered by the NADAC index. I want to provide an example here provided by the Prism Health Group, a consulting firm focused on pharmacy benefits. They looked at a representative commercial payer in their block of business and found that approximately 3% of the claims were not covered by NADAC, but in fact, 19% of the ingredient cost for that client was not covered by NADAC. This means that if a contract were to be NADAC based for this client, they would have a level of gap that they would need to cover to the tune of 19% of their spend to make sure that they are able to procure drugs at a price that's fair for them. The industry tends to cover this type of gap in the NADAC index, by applying AWP-based discounts to those products that don't have NADAC available. Thanks for sticking around to learn about NADAC today. We talked about the acronym, how it works, when it's used, some pros and cons, and finally some fine print on where NADAC may not have full input data set and may not publish a particular price for a particular drug on the index. In an upcoming series, we'll talk about AWP-based contracting versus NADAC-based contracting, and we'll talk about some of the concepts around how to overcome some of these reporting gaps, given NADAC is a commonly used contracting basis. If you found this content helpful, I encourage you to like or subscribe. Please provide us feedback on our website, www.thecoyfarmer.com. Submit an inquiry. If you have any need for consulting services or bespoke training needs for your organization, which might include PBMs, healthcare technology companies, drug manufacturers, and consulting firms. Thank you for your attention, and we'll see you next time.
You're looking for the cure,